There are concerns an ageing cardiology workforce could cause issues for our healthcare system in the coming years. A new study has found over half of the country's specialists are aged 50 and over, while nearly 1 in 5 is older than 60. Well, joining us now is lead author Doctor Selwyn Wong. Kia ora, Dr. Wong. So, this is not a good situation, is it? Were you surprised by the results of your study?
Oh, not really. We did it on behalf of the Cardiac Society. I did it as the chair of the Cardiac Society with my co-author, who was the incoming chair. And we'd been observing that there are gaps and not enough of us around. And as well as that, we could see people of my generation starting to think about exiting. And so it wasn't a surprise that we've found that we have a shortfall of cardiologists in total, and there are gaps in certain places around the country, and a lot has been made of ageing, although because it takes so long to get into it, you would expect that half of us are going to be over 50. But I guess it's concerning that 20% are over 60, and we've seen examples of our colleagues at that age starting to look elsewhere. Yeah,
so you suspected that there was an issue, and this has really laid that bare.
Yeah.
What impact will this have on our healthcare system?
Well, we have a big gap at the moment, but if there was a big glut of increased cardiology jobs around the turn of the millennium. And so, for instance, my institution, Middlemore, went from 2 cardiologists to 10 cardiologists. And so that cohort's now coming through to an age where they're starting to retire. And so somehow we need to replace those ones. And so the impact is that we need a pipeline to replace those ones, but we also need a pipeline to increase the numbers in total.
Yes, so how many more cardiologists do we need to plug the gaps?
On the paper we've got, our figure for New Zealand is 1 cardiologist per 35,000 people. Now, if you compare that to comparable Australia, Canada, they have 1 per 25,000. And if you use that as a benchmark, then we need to go from 158 cardiologists to about 230, another 60, so another 35–40%.
Okay, but this is, I mean, that's a big number, and this is not a problem that you can solve overnight. How long does it take to become a cardiologist?
Well, you go to med school for 6 years, then you are a junior doctor for 2 or 3 years, then you sit the big exam that allows you to specialise. And then if you pass that exam after 2 or 3 years, then you apply to become a specialist of varying things.
So you're about 12 years in by this point, and then you apply to become a specialist.
Then it's another 3 years.
Okay, we cannot solve this problem overnight, so how do we go about solving it?
Well, it's not 12, 15 years, it's 3 years, and so if we picked up those people at 3 years out, it's really competitive to get into a cardiology training position in this country, and so there's very, very many capable people of doing it. And so you could increase 5 a year. At the moment we train 30, and about 30, 35 in total, and so that's 10 a year that graduate. But if you increase that number, and so you had an extra 5 each year, then at the end of 3 years you have another 5, and then another 5, another 5. How much would that cost? Well, it would cost Health New Zealand Te Whatu Ora registrar positions, which might end up being 700,000–800,000 a year for training an extra 5 per year.
Right, and is this a New Zealand problem, or is this something that is being experienced around the world?
In talking to colleagues around the world, it's a worldwide problem, and it's difficult. It's a worldwide market for jobs, and so the jobs in Australia are attractive with remuneration and work conditions, but it's not specific to cardiology in this country. I think my colleagues will know in all specialties and all medical fields, primary practice, it's particularly important, and not just doctors, it's nurses and technical staff, sonographers, physiologists.
Okay, a lot more that we could dive into there. Thank you so much for breaking that down for us, Dr. Selwyn Wong, the lead author on that study. Tēnā koe.
You're welcome.